Transforming Social Norms. Part 1. What are social norms? This is the first in a series of films for AmplifyChange grantees and applicants who want to include social norms transformation in their work. This series will provide you with a step-by-step guide on how to approach working on social norms change. These films are for people who want to see sustained behavior change related to harmful practice that hinder the fulfillment of sexual and reproductive health and rights, SRHR. This first film explains what social norms are and how they influence various parts of society. So, what are social norms? To put it simply, social norms are social rules created by people that allow us to live and cooperate with each other. We rarely think about it, but we need social norms. They help us to create society and collaborate, predict others' behavior, be accepted in society. So, social norms can be positive or negative. For example, they can be positive when communities promote gentle parenting and discourage beating children. They can be negative when there is acceptance of child marriage. AmplifyChange grantees and applicants want to change negative social norms to allow community to adopt new norms that produce positive outcomes. For organizations to work on social norms, it is important to understand that social norms change is a dynamic process and requires working at multiple levels. According to the dynamic framework for social change, these levels are institutional, individual, social, material. Please visit AmplifyChangeLearn.org for more detail on the dynamic framework for social change. We will now give examples on how negative social norms can be embedded into these different levels and affect SRHR. At the institutional level, laws can be influenced by social norms when they prohibit same-sex relationships, where laws are put in place because of views commonly held by lawmakers. Governance structure can be influenced by social norms when they exclude female representation in decision-making bodies in societies where gender equality is not valued. Economic policies can be shaped by social norms when budgets are not allocated for SRHR services for teenagers, because there is a belief amongst policymakers that young people should not have sex. At the individual level, a young woman may not believe that she has control over her fertility and can take contraceptives to avoid pregnancy, also known as self-efficacy. A man may believe that it is emasculating to get a vasectomy. A couple may believe that they are cursed because they are unable to have a child, when simple fertility treatment may be available to them. At the social level, there may not be accessible role models of, for example, women who have chosen to have an abortion, where it is legal and within their right. There may not be networks available to offer support to young LGBTI people because of a lack of acceptance of homosexuality. There may not be sufficient visible female role models promoting the importance of equal participation of women. At the material level, clinics may not offer services that cater to the needs of young people or trans persons. This may be because the needs of these groups are not prioritized due to stigmatizing social norms. There may be a limited number of contraceptives offered to women because the needs of women are not prioritized or understood. Social norms can also influence global policy, as we can see with the current US global Gag Rule. By understanding how social norms can be embedded into different layers of society, organizations can design intervention programs to target specific groups, for example, policymakers, religious leaders, and medical professionals with social norms transformation messages. In the next film, we will describe how to design a social norms transformation project.